My name is Hudson Garrett. I'm the Vice President of Clinical Affairs for PDI and also the President of the Vascular Access Certification Board. My credentials are PhD, MSN, MPH, FNP-BC, CSRN, and Vascular Access Board Certified, so VABC. And this is my story. In December of last year, I was actually a patient for sinus surgery myself and had to receive vascular access therapy, obviously, to start my IV prior to surgery. And it was a quite interesting experience because I went to a very well-respected hospital, had checked out the team, actually had done a lot of due diligence on my end, and proceeded to go to a facility where it took 4 different attempts from 3 different nurses that were not vascular access trained to actually try to start my IV. Even using technology, they were still unsuccessful. Because of that, I actually had to start my own IV for surgery. And so it really makes me appreciate the value of having an actual certified and trained vascular access clinician in those types of settings. As a patient, I have to tell you, I really went into it expecting to have better care than I did. And while the nursing care itself was very good during surgery, I was kind of left with a little bit of avoiding the experience by not having a good vascular access experience from the facility. And so I think it's very, very important. The other thing to look at too is research. We need to continue to evolve and study research in vascular access so that we can actually develop new practices and work collaboratively with manufacturing partners to develop new devices so that we can be more safe for our patients. As the president of the Vascular Access Certification Corporation, we work collaboratively with AVA as well as the AVA Foundation to strengthen research, but more importantly, drive clinical practice through credentialing. It's so important, the work that the AVA Foundation does, because it really drives the clinical practice behaviors of clinicians, not just across the United States, but across the globe. We have to come to one singular voice of really clarifying what is that best practice. Part of that is credentialing, which my group represents, but more importantly, we have to continue to support the AVA Foundation so that we can actually take these evidence-based practices that we know that work to every single bedside, but also drive a change and really have accountability with the practice changes that we don't know so much about, these unresolved issues that exist out there. Once we can come to terms with those and develop actual clinical practices and publish those through peer-reviewed research, we'll really be able to change the tide with vascular access and give every single patient the best possible outcome from good evidence-based practice. As someone who travels throughout the United States domestically, but also internationally as well, I've seen the good and the bad of vascular access research. And I think we're at a very pivotal tipping point, if you will, of creating that next wave of research. And that can come from every single individual, every single bedside clinician. It does not have to be someone with a PhD or a master's degree, but that nurse, that clinician, that multidisciplinary professional association like AVA can really help drive that with the AVA Foundation. We have to take a stand and actually not settle for less than what we have. We have to actually stand up and say that there are unacceptable practices taking place, and there's a way to actually change that, and that's through research. If we can actually create a research body of knowledge that answers some of these unresolved issues, then we can really move forward, and we can take these bedside practices to every single patient, both in inpatient and outpatient settings. And I think that's so important, the work that the AVA Foundation is doing, because healthcare is no longer delivered just in the 4 walls of the hospital, but it also is delivered in the home care environment, in pharmacies, outpatient infusion centers, dialysis, and other ambulatory settings, which makes the need for these trained clinicians as well as evidence-based research for every single care setting even more important. So we also have an opportunity as an AVA Foundation, as a certification board, and also AVA, of creating evidence-based practices in collaboration with other partners. These can be other association partners, such as the Association for Professionals in Infection Control and Epidemiology, critical care medicine associations, but also our industry partners. Working with industry, the research and development groups, the medical science liaisons, sales and marketing professionals is a great way to take your voice and make it be heard. And it also drives innovation, and it's so important to innovate continuously to bring new devices, solutions, techniques, and education modalities to every single clinician in the variety of healthcare settings that they might work. So partnership with the industry and also the AVA Foundation, I think, is a great way to move the ball forward and also bring some of those clinician generated ideas to industry and then to the marketplace.